Let's jump into the exercise piece. There's a wide range of different intensities, different types of exercise. When it comes to managing brain health and optimizing, where is that sweet spot?
That's a good point. And, again, this comes right back to mechanisms. What are you doing? I'm not an expert in nutrition. We've been looking for years at the molecular biology of neurodegeneration. So you can see how each of these things contribute. You can literally trace the molecular pathway from inflammation, NF-kappa B activation, into your nucleus, turning on a whole set of genes that include ones that cut the APP into making the amyloid. So you can trace these beautiful pathways. And so in exercise, what you can do is show that you really want to have both. You want to have some aerobic exercise and you want to have some strength training. And they do different things. As an example, strength training improves your muscles, of course, which improves your insulin sensitivity and can also have an impact to increase your ketosis. When you're doing aerobic exercise, you also can increase ketones. You're saying, I need more than just glucose now. I need you to break down the fats to make the insulin. And of course, there are other things that can support your body, like creatine and carnitine and amino acids. These sorts of things get supported as well. But giving yourself some ketones, very interesting. And a group out of Cornell years ago showed that when these ketones are produced, they enter the brain. And they actually interact with histones to make it so that you now remove the inhibition to producing brain-derived neurotrophic factor, which again, when it's low, is associated with Alzheimer's disease. So now the ketones are removing this block, and now you're making more of the BDNF and helping yourself. Now, what else do you do when you're exercising? You improve your blood flow. You improve your oxygenation. These are absolutely critical. That borderline blood flow is contributing to cognitive decline. So we recommend, number one, look into some resistance bands because they improve muscle formation and they improve blood flow as well. And these were used by some of the Olympic athletes. Originally invented as Katsu bands, but there are other now resistance bands that you can get relatively inexpensively. And then also look into EWOT, exercise with oxygen therapy, especially for anyone who has any decrease in oxygenation or any sleep apnea or any vascular issues, so any sort of vascular disease. You can improve this with exercise with oxygen therapy. And there was a group out of Israel that had a nice study showing using HBOT, hyperbaric oxygen. Now, the one disadvantage to that, it doesn't give you the exercise part of it, but it does give you better oxygenation. So both of these things, whether EWOT or HBOT, can be very helpful with supplying your brain with appropriate oxygenation. All of these things are critical.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
We actually have a pro-inflammatory state with ApoE4, and so we have a slightly shorter lifespan and, of course, a markedly increased risk of developing Alzheimer's. Great. So we can address that.